Metoprolol side effects coming up.
Sunki.
Hi everybody, it's your pharmacist Sunki here. Today we are going to talk about metoprolol. Make sure you stay until the very end so you don't miss out on any important information. Everything I say today is of general nature only. It does not replace the need to see your local healthcare provider. Let me know down in the comments below what other topics you would like me to cover. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up. Without further ado, let's rock it. What is metoprolol? Metoprolol belongs to a group of medicines called beta blockers. It works by reducing the workload of the heart, thus the strain of the heart. It lowers the heart rate and also widens the blood vessels to reduce blood pressure. Metoprolol is known for its brand Lopressor, Betaloc and Toprol XL. What is it used for? Metoprolol is used to treat high blood pressure, also known as hypertension, irregular heart rhythm, also called arrhythmia, heart failure, and to prevent chest pains caused by angina and improve the survival after a heart attack. It is also used to prevent migraines. When you must not take this medicine, do not take metoprolol if you're allergic to it or to any other beta blockers that you might have in the past, or any ingredients that is listed on the leaflet of metoprolol. Symptoms of allergies may include shortness of breath, wheezing or difficulty breathing, swelling of the face, lips, tongue, or other parts of the body, rash, itching, or hives on the skin. If this happens, send yourself to the emergency of the closest hospital. Note: there are other brands of metoprolol, so if you are allergic to certain ingredient in one of the brand, your pharmacist can help you find another brand that does not contain that ingredient. Tell your doctor if you are pregnant, planned, intend, or likely to become pregnant. Metoprolol should not be used in pregnancy unless the doctor tells you to. Tell your doctor if you are breastfeeding. A small amount of metoprolol passes into breast milk and it is deemed not enough to cause any problems to your body, but I still need you to talk to your doctor before breastfeeding. This is especially important if your baby is premature or has any kidney problems. Tell your doctor if you have any medical condition present or in the past. This includes any heart, lung, kidney, liver, eye, thyroid, blood circulation problems, and diabetes. I want to particularly talk about asthma. Taking a beta blocker may trigger your asthma symptoms or make them worse. However, not everybody with asthma is sensitive to metoprolol, and metoprolol triggering asthma is very rare. Your doctor may decide to prescribe you a different medicine or increase the dose of your asthma preventer. Now, if you have forgotten to tell your doctor any of the above that I've just mentioned, tell your doctor now before you start the medication. Medicine interactions. Metoprolol can interact with many other medication. To name a few, anti-inflammatories, your NSAIDs, such as diclofenac, brand name Voltaren, ibuprofen, brand name Nurofen, mefenamic acid, brand name Ponstan, naproxen, brand name Naprogesic, which you can all easily buy from the pharmacy without a script. Other interactions are your cold and flu tablets that contains phenylephrine and pseudoephedrine or diphenhydramine. This can be easily purchased in your pharmacy without a script as well. These are medications that could easily be purchased from the pharmacy without a script. So watch out for these interactions if you're on metoprolol. Potassium supplements. Another interaction of metoprolol is with potassium supplements. When you take metoprolol, there's an increased level of potassium in your blood, so you want to avoid any potassium supplement or salt substitution. Bananas contain high quantities of potassium as well. 1.5 big banana equals to 1/600 milligram potassium tablet. So avoid taking large quantities of bananas. Take them only occasionally. Too much potassium in your blood causes hyperkalemia. Symptoms of hyperkalemia are like chest pains, trouble breathing, or in severe cases, a cardiac arrest. Now, these are definitely not the only interactions, so make sure your doctor and pharmacist know all the medication that you are taking. This includes all the herbal supplements, vitamins, and minerals that you can buy without a script from your pharmacy, health food store, or supermarket. How to take metoprolol. Dependent on your condition and what other medication you are on, the doctor will prescribe you the appropriate dose. Doses usually ranges from 12.5 mg to 200 mg. It comes in slow release tablets, which is taken once a day, or immediate release, which is taken anywhere from 2 to 4 times a day. Swallow the tablet whole with a drink of water. It does not matter if you take it before or after food. Continue to take metoprolol for as long as your doctor tells you to. Do not stop taking the medicine without checking with the doctor. If the doctor thinks that it's time for you to stop metoprolol, the doctor will instruct you to gradually reduce the amount before completely stopping it. This helps to reduce the chance of your condition worsening and prevent any unwanted heart problems. What to do if you forget to take it? If you forget to take it, if it is almost the time to take the next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember and then go back to taking the medicine as you would normally. Do not take a double dose to make up for the dose that you have missed. This may increase the chance of you experiencing side effects. If you are not sure what to do, talk to your doctor or pharmacist. If you have trouble remembering to take it, set an alarm clock on your phone to remind you at the same time every day. If you have taken too much, call the poison helpline of your country or go to the emergency department of your nearest hospital. Do this even if you have no signs of discomfort or poisoning. You may need medical attention. Symptoms of overdosing may include the following: dizziness, fainting, difficulty breathing or swallowing, swelling of the hands, feet, ankles, or lower legs. Things you have to be aware of. Do not drive or operate machineries or do anything that may be dangerous to you before you know how this medication affects you. And don't drink any alcohol while you're taking this medication, as it will cause extra drowsiness. Remember to spend some time reading the leaflet of the medication. If the leaflet is not in a medication box, ask your pharmacist for one. Diabetes. If you have diabetes, you need to take extra care to measure your blood glucose levels and do it regularly, because beta blockers can cause an increase in your blood glucose levels, especially when you first start taking them. This effect usually settles with time. Metroprolol can also reduce the warning signs of low blood sugar levels, such as feeling of fast, irregular, or strong heartbeats, like palpitation or tremor. So be aware and be careful of it. Side effects. Metoprolol is a widely used medication and it is tolerated really well amongst many people. Like all your medication, it comes with side effects, but not everyone experiences them. Some of the more common side effects of metoprolol are tiredness, feeling weak, and dizziness. If this happens, stop what you're doing, rest. Sit down or lie down until the dizziness goes away. Do not drive or operate machineries and do anything else that could be dangerous. You might get lightheadedness as well, especially if you stand up too quickly. This is called the orthostatic hypotension. So be careful when you're getting up from a lying down or a sitting position to prevent any falls. Get up slowly. And if possible, hold on to something as you get up. Headache. Headache should only last for a week. If this goes beyond that or if it's severe, talk to your doctor. Things that you can do within this week is have lots of rest, drink plenty of water, avoid drinking alcohol, and ask your pharmacist to recommend you a suitable painkiller. Nausea, feeling sick, or vomiting. Stick to simple meals and avoid rich or spicy food. Take smaller meals and drink water in between meals instead of with meals. It may also help if you take metoprolol after you have eaten. Stomach pain. If this happens to you, rest and relax. Eat and drink slowly and have smaller and more frequent meals. Putting a heat pad, heated wheat bag, or hot water bottle on your stomach may also help. The above side effects will usually go away within a few days, But if it doesn't go away or it becomes more severe, speak to your doctor. The next list of side effects are more serious side effects. If you experience it, tell your doctor immediately. Buzzing or ringing in the ears, or difficulty hearing, difficulty sleeping, depression, anxiety, nightmares, reduced sexual drive, weight gain, hair loss, hair thinning, muscle cramps, or painful joints. Now, if you experience any of the below side effects, you need to stop the medication immediately and send yourself to the closest emergency department of the hospital. An anaphylactic allergic reaction. Symptoms include shortness of breath, wheezing or difficulty breathing, swelling of the face, lips, tongue, or other parts of the body, rash, itching or hives on the skin, swollen ankles or legs, chest pains, an irregular heartbeat, a fast heart rate, high temperature, 38 degrees or 100.4 Fahrenheit and above, trembling and confusion. These are signs of too much thyroid hormone in the blood, called thyrotoxicosis. Yellowing of the skin and eyes, called jaundice, coldness, burning, numbness or pain in the arms and legs, unusual bleeding or bruising. More side effects information can be found on the leaflet of the medication. I will also put a link down below for you so you have access to them. Now, even then, the list of side effects there are not complete. New side effects can pop up. So if you experience any side effects that is not listed there, you can always report it to your country's medicine regulatory agency. In the US, it's called FDA MedWatch. In UK, it's called Yellow Card. And in Australia, it's TGA. In this channel, I've also made other medication and health-related videos to help keep your body strong and healthy. It is a growing library of medication and health information. Besides a pharmacist, I'm also a singer-songwriter, music producer, and an actress. If you're interested in knowing my other life, check me out on my other videos in my other playlist. Now, if you haven't already subscribed to my channel, hit the subscribe button now and thumbs up, and follow me on Facebook and Instagram. My handle is @SunkiOfficial, and it's your pharmacist Sunki here with lots of love. See you around.